What if someone says that we haven't got clinical studies yet to prove that microdosing is safe over the long term, and it could be doing long-term damage because these compounds have only been around for a couple of years now, and in terms of people really using them en masse?
Well, I think we would be far more concerned with high doses. And that's what most people are on high doses. And we're really not seeing the safety signal blowing off the way that people are concerned about. In fact, we're seeing the opposite of that. Some really good data has come out refuting many of the studies that were so concerning in the past few months even. And some of it's just being presented at different conferences, so it's not being published yet, but I keep up with all of it, and it's very exciting. We're not seeing a signal on pancreatitis. We're not seeing bowel obstruction. Gastroparesis, I think it's fair to say that the highest risk group for gastroparesis is type 2 diabetics. It's because they are sugaring up their vagus nerve. The high blood sugar is actually destroying the vagus nerve, which is causing low-grade gastroparesis. So they're already sitting on the edge of it in many cases, and then they're being cranked into these crazy high doses and getting thrown over the edge. A real concern is biliary disease, so gallstones. When you go on a very severely calorically restricted diet, your bile sludges up in your gallbladder. So a gallbladder is already very often compromised in an obese individual, and it's already sludgy, and it maybe already has some stones forming. And then they go on a caloric restriction. That lack of food going through the digestive tract will cause the bile to sludge up. They'll throw a stone into the pancreas. The number one cause of pancreatitis is fatty pancreas, which people with metabolic dysfunction already have. The second cause is a gallstone, and the third cause really is excessive severe weight loss done too quickly. So we're taking people and thrusting them up on these high doses. They're often already sitting on the edge of many of these conditions, and then they're getting thrown over the edge. It's like, well, yeah, no wonder. When I started looking at the terrible side effects, I was like, well, of course. I mean, anybody who is severely diabetic or severely obese is already sitting on the edge of that. And so my argument is, why are we throwing people on these high doses and sending them over the edge? I don't think taking a tiny amount of something is nearly as concerning as the high doses. But the rates that you're hearing in the media are not the rates that are showing up in the studies, even of these terrible side effects I just mentioned.
I have always believed that there's no such thing as a free lunch
That's fair.
in life. And, whenever someone tells me that something is good for me, um, it always comes with a cost. That just seems to be the way that life works. And I like that life has that balance to it where there is no, anything that's worthwhile, whether it's starting a business, having a great marriage or relationship, raising kids,
Right.
there's so much of an upside and there's so much of a cost, you know? And so as it relates to microdosing Ozempic, my brain is going, there's got to be a cost.
Yeah,
If
where's
there
the
is
catch?
any reward, there has got to be a cost.
That's fair. Well, you have to think about the risk-reward ratio. And that's something that we don't talk about in medicine. I think COVID really showed that. You have the risk of COVID, the real risk of COVID, whatever that looked like, depending on the scale of susceptibility you had for poor outcomes. So if you were 65 or older, you were in poor health, there was a real risk. And then you have the reward. We have to look at what lockdowns did. 146% increased risk of suicidal ideation. All kinds of, I get the stats on that. I don't even want, that makes me sick when I start thinking about what happened. I was just driving over here and the Uber driver was telling me how nobody goes to church anymore and all the the pubs are closing because the pub culture is going away, not because of drinking, but because of just people gathering in community. He said COVID was the end of so much of London that he saw. And he's been driving in some form or another for 15 years through London. And so we have to look at risk-reward ratio, and the risk of walking around in a chronically inflamed state for somebody who, say, has psoriatic arthritis. I have thought about this, and I'm like, you know what? The risk that I'm seeing in the data from high doses of this is probably not nearly the risk of a tiny dose of it, and it certainly is better than the clinical outcomes of walking around with raging psoriatic arthritis for the next 30, 40 years, which is dementia, my spine fusing, lack of movement, muscle wasting, chronic pain, so on and so forth. The real risk of obesity is tremendous. And something that a lot of people don't appreciate is when we start to gain weight in middle age, that's a low-grade insulin resistance happening. And so a woman will gain, somewhere between 45 and 50, she might gain 10 pounds. Okay, we get a little thicker as we get a little older. Okay, maybe in the next 5 years, she gains another 10 pounds. And we just sort of accept it as a society. Like all our moms kind of get bigger, right? And all moms just get bigger and they all end up looking like the moms, the grandmas, everyone ends up in my family round by the end of it. Well, now my family's starting to drop dead of heart attacks. And they're all on lifestyle medications. They're on statins and blood pressure medications and all of these things. And my thinking is, what if that process never even started? What if I was able to intervene with not just GLP-1s, but all the other tools I had available to me that I didn't have when they started? I wasn't out of school yet. I didn't know what I know now. What if I was able to intervene and give them decades more of a high quality life? And that's what longevity medicine is. That's what hormones are. That's what bioidentical hormone replacement is, and what these other peptides are that we've been using for a long time in decades in clinical practice. And I don't know if you probably don't, but the Women's Health Initiative 20 plus years ago came out with data showing estrogen and progesterone replacement therapy is dangerous, and all women were immediately ceased. Doctors got scared. Everybody got taken off their hormones. We just destroyed an entire generation of women over the past 20 years. Doctors that were smart, like myself and my colleagues, we read the data and we realized that they were giving them progestin and not progesterone. And there was nothing unsafe about what they were getting. And so we kept everybody on their hormones. And I'm like, well, here's informed consent. I would tell the patients, this is the data. This is what we're going to do. They agreed or didn't agree. That's called informed consent. Here's your risk to reward ratio. And they've just reanalyzed the data in the past few months and decided that they were wrong. It was bad data. They shouldn't have taken all these women off of hormones. The amount of dementia and cardiac disease and bone fractures and on and on and on that happened because those women were starved of hormones is devastating to me. So it comes down to understanding the mechanism of action of how these things work, sharing that as best as you can with your patients, and then having a conversation and letting the patient decide.
So, but in the case of the microdosing, you're going to tell me the upsides. In that informed consent scenario, what would you tell me the downsides might be?
I would tell you the downsides that we see in the data with the high doses.
Okay, and you would extrapolate from there that you would have those downsides, but in smaller frequency.
Much, much smaller potential. But also you keep a sharp eye on your patient. You don't just send somebody out with a prescription and say, see ya, good luck. It's close monitoring. You're making sure to keep track of things. We're running labs, we're checking in, we're making sure symptom pictures aren't showing up. And it's upside versus downside.
People are going to listen to this and they're going to think, okay, so I should be microdosing Ozempic. And what might happen is people will go online and they'll try and buy Ozempic and then they'll at home start, I don't know, putting it in their tea or whatever.
Oh no, that's not a good idea. I don't know what the situation is in the UK, but I know in the United States, we have longevity doctors. We have smart functional medicine doctors. We have doctors that have access to compounding pharmacies. And I'm hearing, at least in certain parts of Canada, there are compounding pharmacies. I don't know what the situation is in the UK. I believe there are. Compounding pharmacies are being driven out by big pharma because they're pretty punk rock. They're doing individualized medicine for patients. They create medications for a patient at the dose that's tolerable for the patient. And I highly encourage folks to do their research and find a doctor who's willing to work with them. And at the very least, consider the starting dose that is in the pre-filled pens and talk to your doctor about not escalating so quickly and making sure that you implement the other lifestyle factors aggressively so that you don't have to increase the dosage. And I'm hearing from people in my program that are doing quite well that way. They don't have access to compounding pharmacists. They don't even have access to like a longevity doctor. I understand that's not available for everyone. And there's economic issues. I get all that. So they're finding great success in that 0.25 milligram, and they're being really diligent about all the other lifestyle interventions, and they're doing awesome. And so I don't know any doctor that would want to crank up a dose of any medication. If a patient came to me and said, Doc, I want to start on this, the standard is this dose. I want to start on this dose and I don't want to go up. I'd be like, hallelujah. Because anytime you increase the dose of anything, you're going to get side effects.
If you love the Diary of a CEO brand and you watch this channel, please do me a huge favor. Become part of the 15% of the viewers on this channel that have hit the subscribe button. It helps us tremendously, and the bigger the channel gets, the bigger the guests.